Look away. Did you start it?
It's been on.
Oh. We start the NEAT evaluation with history, asking 3 questions on past history and present history. We go on to OPQRST, which is onset, provocation, quality, region, severity, and time. And then we move on to sample, which is the signs or symptoms, allergies, medications, past history, last uh, last oral intake, and events to present. We move on to inspections, which is on swelling, discoloration, deformity, their gait, the genu falcon, the genu orin, and the genu recurvatum. Move on to the bony palpation on the tibia, plato, tuberosity shaft, the femur, um, the femur, condyle shaft, the fibula head, the femur, condyle shaft, the fibula head shaft, and the patella border body, which is in the between. The soft tissues, which is the medial collateral ligament, the lateral collateral ligament, the menisces at joint line, which is the lateral meniscus, and the medial meniscus, the patellar tendon, and the popliteal fossa, which is behind the knee, the quadriceps, the quads, which is concludes of the rectus femoris, which is believe right here, the vastus medialis, which is around here, and the vastus lateralis, and rectus uh, the past answering group, which is the Sartius, the Gracies, and the Semitendinitis. We'll move on to hamstrings. Hamstrings, which is the bicep, just leave it like that. The bicep femoris, which is on the lateral side. The semimembranosus, which is on the lateral side, and the semitendinosus, which is on the medial, on the middle part of the hamstrings. We move on to range of motions. Flexion at 135 degrees. Internal rotation 10 degrees. 10 degrees. 10 degrees. Extension 0 degrees. External rotation 10 degrees. Move on to flexion on the hamstrings and the bicep femoris. Flex it. We move on to the extensions for the quads, for the rectus femoris, the vastus medialis, the vastus lateralis, and the vastus intermedius. Then we move on to the neurological motors, which is the L2 and L4 knee extension and hip abduction, the L4 ankle dorsiflexion and inversion, which is dorsiflexion, inversion, the L5 toe extension. Just try to extend your toes. Yeah. The L5 and S1 knee flexion, flex your knee, and the S1 ankle eversion, and the S1 and S2 ankle plantar flexion, which is ankle plantar flexion. Sensory and dermatomus, L3 medial knee, which is L3, the L4 medial lower leg and medial surface foot, which is this part, the L5 dorsum and foot of interior lower leg, which is L4. L4 was this side, L5 is right through down here. The S1 lateral surface and foot, which is the outside right here, it goes down, and the S2 posterior knee, which is behind. We move on to reflexes of L4 patellar tendon. Usually, if they're sitting down on a bench or in a medic bed, you tap between the knee to see a reflex, and the S1 Achilles tendon, which is just the taps. Try to turn around, which is just the taps to see any reflexes. The blood flow tests, which are the recapitulation test. The dorsal pedal artery pulse, you just press on their nails. Just press on their nails and check their blood, and then you just compare the legs bilaterally to check that they are okay. How long was that one?
8:28.